Good afternoon, dear friends. I am Dr. Srinivas, Professor of Dermatology. I have already uploaded some talks related to dermatology, some in a general section, some in a specialized section of dermatology. But today I will be tackling one of the most important aspects in the patient management. And some of it is an approach. I'll be discussing how we can do the counseling for various skin diseases. But let us understand why this counseling is needed. As soon as we pass, we learn the subject. We are brimming with knowledge, both from the textbook and from the great lectures we have heard from the expert teachers and from what we heard from the journals. And of course, today, what Uncle Google teaches us and WhatsApp, the social media, the interaction, what that teaches us. However, behind all this, there is a human being, and the human being has got certain expectations. It is not a machine. So each person has to be dealt in a different way, in a way by which they can understand. They should be made to understand what problem they have, what we are trying to do to them, what we hope to achieve, and what we cannot do, so that we set the bars at the right place. If we don't do this during the initial time when the patient comes to us, they have been referred, especially for senior people like us, they have been referred from others, told that, okay, you go to this person, he will make it all right. So they come with high expectations. So you must bring them down to earth. You must tell them what they can really, truly expect, and then go ahead and treat. And then you will find that the disappointment will be less. And if disappointment is less, satisfaction will be more. Like counseling is much more sensitive, or nearly as sensitive as taking care of a highly high-strung person, and the type of ring matters in this case. But the real counseling with patient, to some extent, may be true, but then wiping off the tears is just important over here as well as for the patients. What is happening? Patients do not understand what is happening. To us as doctors, certain things seem obvious. That is because we are soaked in this atmosphere, lived in this atmosphere. The knowledge has seeped into us. But patients do not know many of the common things which we think everybody knows. So we have patients who are very confused. Or an attender, be it a mother, parents, friends, wife, husband, they are very, very confused about what is happening. They don't know. They want to know what is happening, and they want to know what we can do for them. And so when they come to us, you will find that they'll be looking at us. They'll be asking, why is it happening? Are they trying to judge us? Are they trying to learn what is the exact cause? Maybe to some extent they do really want to know. But most of this person who ask this question as to why it is happening do not really want to know the cause. They are looking at your eyes to see whether you are confident about what you know. They are testing you. They're looking at your eyes to assess your understanding of the problem, and also the honesty which is betrayed by the eyes, which is communicated to the patient and the attendant. So that is why many people ask, why is this happening? You will explain the whole thing, technically, you'll explain a lot of things, and you will think that, oh, I have done a great job. I explained the whole thing as I would to my PG student, and the patient will once again ask, why is it happening? So that is what they are trying. So you will have to try to once again tell them in a way by which they can understand. Today I'll be discussing some of the not necessarily in this order, but some of the common condition as to how I go about counseling for this. But before I take up all this, let me take up the most important thing is the steroid. Counseling regarding steroids. Today there is a steroid phobia. Many people have read the Google, or doctors tell them they're giving you steroids, and Don't go to that doctor. He will give too much steroid. This doctor's prescription will have too much steroid. And some persons will come and ask, does this have steroid? Some persons will say, beginning, don't give me steroids. So as a doctor, we have to understand as to what made them come up with this complaint right at the beginning, or this request right at the beginning. It is the media, it is the social media, it is the discussing with the various friends that have led to them. So here we have to give them the knowledge about steroids. We have to tell them, look, steroids are essential for life. In your body, there are steroids. In my body, there are steroids. We would not exist if there are no steroids. Steroid is very, very important. Steroid is like fire in kitchen. If there is no fire in the kitchen, you won't have no food. Well, I do agree that this steroid, this same fire can burn a house or burn a forest. But nevertheless, just because it can burn the forest, are you not going to cook and have food? So it depends on where it is used, how it is used, who uses it, before you make a blank comment that you don't want steroids. You tell them that I don't want you to have side effects. But if at all I do have to give you steroid, I am going to tell you that I'm going to give you steroids, and I'm going to tell you why I have given you steroid. And then it is up to you whether to decide whether it is required or not. And once you explain this to the person, you have two persons you have to look at. You cannot look at the patient alone. You'll have to look at the attendant. Quite often, you'll find that the attendant is much more attentive and much more compliant than the patient. So as you grow up, you will realize that among the two patients, or the attendant and the patient, who is the one who is capable of understanding, who is the dominant one, and you'll have to target the dominant one while not neglecting the other one. It's a trick which you learn over a period of time. So that's about steroids. Let us leave behind steroids. Let us go to urticaria. This is one of the most disturbing one, more so when it occurs in children. The parents become very restless. They will come to you as if, sky has fallen on their head. Even the patients will come. They will think something that is totally unusual has happened to them, that they are an exception to them. And they'll be, they, they're like a bridge which wants to, so a dam which wants to break and let loose the water. So make them comfortable, make them sit. To some extent, let them talk. They will tell you, and they will explain how the urticaria comes, how the itching is all there, how they have taken various drugs, how they have gone to various people, and all that. So allow them about 3 to 4 minutes, because ours is a busy clinic, and unfortunately, we do not operate giving 20 minutes per patient or 30 minutes per patient. We have but 5 to 7 minutes per patient is the time which we can allot considering the load of our patients. So such being the case, once the person comes, after their initial steam has run off, then you tell them the definition of this condition. That urticaria is a chronic, idiopathic, spontaneous, recurrent condition. That is the definition. So what is this meaning? Chronic means something that is going to last, and doctor does not know how long. Recurrent means it can recur. Idiopathic means we don't know the cause. Spontaneous means it comes suddenly. So since it is an idiopathic condition, if you ask me the cause, how can I tell you the cause? Since you're telling me that, but what will happen? What I can tell you is that almost in all persons it goes off. But the trouble is, neither I know when it is going to go, nor do you know when it is going to go. It is the patient, it is the disease which knows when it is going to go. And then you will wonder, what can the doctor do for you? What I can do for you is, I can find the least amount of medicine by which I can keep it under control. And please make sure that you come, do not stop the drug because it is under control. Use your cell phone, you're using it for so many things, for WhatsApp and whatnot. Put an alarm, take the drug. This drug will not make the lesion that has come go. It has got a preventive action. It is going to stop the next lesion from coming. So do not stop the drug. And if you do not get the lesions while you are on drug, that means treatment is working. If you're still getting, come back to me. I will increase the dose or change the drug until we find the dose by which you do not get the lesion, and we'll maintain you on this. And this is a cat and mouse game. Once you explain all, and also tell them that food is the least important thing. Do not avoid any food. take all the food and the medicines. Food I'll be discussing in the end separately. Same thing for dermographism. Again, patients are very disturbed. We tell them that this is a condition which is normal, which is essential for life. For some reason, it becomes symptomatic. Itching is there. Eventually, it will settle down. Until it settles down, please do not stop the medicine. It will soon, over a period of time, settle down, and it is not a serious condition. Same counseling as urticaria. Maybe you will have to tell a little more for the person. If the person is with dermographism alone, the person with urticaria and dermographism, we combine these two and do the counseling. This is, of course, a disease for which what counseling can help in this person is the problem over here. So telling them that it is only a skin disease is difficult. So here what we are worried about is how much improvement we can give them. So here we tell them about the pathogenesis. They will ask you why it is happening. We tell them that it's an autoimmune disorder. What is an autoimmune disorder? Autoimmune disorder is something like, we have to tell it in the language the patient knows. We tell them that, imagine you are working in a factory, or a factory is there, factory has got security. That security is supposed to take care of the factory. But can there be circumstances where the security can do harm to the factory, can destroy something in the factory? So that is what is happening. Immunity is there. Your body has got immunity. My body has got immunity. And that is like security. Sometimes this immunity can act against our body. And in this case, there is a cell which produces this pigment melanin known as melanocyte. And our body's immunity targets that. And once it targets that, it destroys that. And once it destroys that, it cannot provide the pigment. And once it cannot provide the pigment, that area will become depigmented, is what is happening. Then they will ask, can it be cured? Then we tell them that there are different types of vitiligo. Some of it can be cured, some of it cannot. There are certain types where it occurs over the extremities. That means areas where the hair is not there, such as the tips of the finger, the lips. I may not be able to cure it. I might be able to arrest it. Having said that, I can also tell them that in 4 to 5% of the cases, I have seen them pigmenting well, but most often, most people do not. We tell them right at the outset, whereas the lesions on the body can disappear. So once we tell them that it depends whether it is a hairy area, non-hairy area, or tell them that this person has got a white hair and that can be, those persons with leukotrichosis or white hair, the result might be slow. Or in lips where there is no hair, the pigmentation may take long time. But you can also tell them that in areas such as lips, over a period of time, once disease is arrested, I can do surgery like blister roof grafting, or I can do various other procedures. At this point of time, my objective is to arrest the spread with medicines, initially with medicines that do not have side effects. Subsequently, if that is not effective, I may go in for medicines which have side effects, and I'll be telling you about those medicines as and when I give them. So that is for vitiligo. Another thing which we see is the insect bite reaction. Quite often, prurigo simplex is another name for it. Lichen articulata, so many names are there. Wherein most often in children, but sometimes even in adults, more often in atopics, they will come with multiple lesions, mosquito bite allergy or whatever type of allergy. So we have done the prick test with the insect bite, and we were able to demonstrate the positive allergy in about 6 to 10% of the cases. In many cases, we were not able to demonstrate the allergen by prick testing. However, here we tell them, what we tell them is that when the insect bites your child, it liberates certain antigens which are poisonous, and this sort of mixes with the blood vessels in the skin and starts moving in various places. And your child's good immunity comes and fights with that and arrests that. So it is the protective phenomena which is happening in this case. So once you tell that it is a good immunity protecting the child and is of interest to your child, then the patient relaxes. They say, well, if that is the case, even though there is trouble for some time, then you tell them, for a period of time, it will go away. And my treatment is aimed at one, reducing the frequency of insect bite, reducing the severity of the lesion by applying some topical, and also reducing the symptoms by giving some antihistamines. And this may go on for a long time. And by looking at it, most often I cannot tell which insect, although mosquito is the commonest. Because some will tell I am getting on the head, but the insect cannot has not bitten my head. So how do you explain that? If you give this explanation, then you can tell them that these lesions need not occur only at the site where the insect has bitten them, but as it is flowing through the blood, wherever there are constrictions, wherever blood flow is impaired, or wherever a person scratches and there occurs damage to the blood vessels, there the antigens can accumulate, there the antibody can come and initiate the itching, which can present with prurigo. So thus you explain to the patient why he is getting so many lesions, why he is getting at site where it is not bitten, and also tell them that it's a protective phenomena and it will go off. Next is the pemphigus. I'm sure you have to counsel about pemphigus here to explain them that our skin is constantly changing, but then it is something like the wall of their house. Give them the example of a mason. How does a mason build a wall? He takes a brick, he puts cement on either side, above it, and then lays another brick on the top, and once again puts the cement. This is a disease wherein that cement, which is holding the bricks together, goes off because of the antibodies produced by your body. And our aim is to suppress that antibody. So this is how we explain the pemphigus, the brick and mortar principle. What about bullous pemphigoid? We tell them that this is like a skin is like a bed. This bed is anchored below to the cot by certain cells. Here, our body produces some antibody against this cell or the thing which is holding it together, like the mat which has got tucks, this thing, tacks which are driven through, tacks which are driven through. That is being dissolved, and because that is being dissolved, your skin is separating, and in that area the fluid comes and causes this blister. Psoriasis is another. Almost all persons will ask why it is coming. Unfortunately, we also don't know the exact reason. And in these cases, we tell them that this is caused by multiple factors. It could be the body's background, the atmosphere, the stress factor, the smoke, all these factors. Some are acting in me, some are acting in you. But in some, these factors come together. And once they come together, then they initiate the disease. Once the disease gets initiated, it keeps on propagating. And tell them that we do not have cure for this condition. We have only control. So this aspect, because the persons will use cure and control synonymously. They will tell it got cured and came back. So we will have to tell them that when we say cure, a disease goes and does not come back. When we say control, that means the disease severity has been brought down and is being kept under check with medicines, may remain in check for a long time, but there is always a possibility. So we tell them, we educate them the difference between the word which we are using, the control and the cure, because for them, cure and control by definition means the same. Melasma is another condition which again many people come. Very rarely we find that it is drug induced. Extremely rare. To that, till now I have never seen a person taking phenytoin or something coming to me with melasma. They might be taking, they might be getting it, but they have not reported it. But OCPs very rarely, pregnancies very rarely. It is not that common. Many persons we find that the child, the youngest child is 16 years old and they have got melasma for the first time. But then in some persons, you do find the link. So you tell this person that this is pigmentation which is occurring because, possibly because of the effects of hormones. It is not an abnormal hormone, but it has got this effect on the skin. I personally, though I cannot tell it often, I personally believe that melasma has a purpose. It is a natural sunscreen, is what I think. Because what will happen is once you give the drug, the melasma goes down. Once you stop it, comes back. Why does it come back? Because it has to protect, is what I look upon it. But I have not conducted any study to really prove this hypothesis. But then it happens in all these cases. So we tell them that protection from sunlight is important, treatment is important, and then if you stop the treatment, this condition will come back. So we are not talking of cure, we are talking of control, and then the drugs also may lose efficacy, may develop side effects. So we have to rotate the drug. It is not that I give you one drug, you can completely continue that drug for long. I'll be seeing you every 1 month, 2 months, 3 months, and I'll be altering the prescription. Do come regularly and be assured nobody will come. But then you have done your job. Lichen planus is another condition, which again we have to tell that this is an idiopathic condition. It is not a serious condition. It is not a transmissible condition. It is not related to food. It is a self-limiting condition. And my job is to keep it under control, limit it till it goes away. I may use phototherapy, I may use various drugs, I may use some drugs like metronidazole or steroids or immunosuppressives, whatever. That is not the issue. Our job is to find out, you tell them that my job is to find out which drug is going to keep it under control, and I will keep it under control till that time. And then at the same time, you have to tell them that when this goes off, that area is going to remain black. So you will have to tell them right at the beginning that my treatment is for the lesion which is raised, for the lesions which are itching, and not for the black color. You tell them this black color is a post-inflammatory pigmentation. This tells the story that a disease was there which has subsided and gone off. This is something like tattoo, which over a period of time, the body will remove. The example I give for this is the one which I have put, a forest fire. What happens in a forest fire? There is fire over there. The forest thing, people come, put off the fire. And then after some time you go, the fire is gone, but the black, discolored, blackish earth is there in that place. Over a period of time, the forest invades and clears it. You tell them this is like the forest fire. After in its wake, there is blackness over there. You're not going to put sand over there or water over there because there is no active disease. Just as the forest comes and clears that black earth and it becomes normal, your body will clear it. It will take its time, and please wait for it. Food is a thing, again, many people ask, many people implicate. To them, I tell them that food is not as important a thing which you believe. Food rarely causes any problem. Most of the conditions which you imply, for which you say for my urticaria, it is caused by fish, it is caused by brinjal or the eggplant, it is caused by this. Whenever you identify multiple causes, it basically means there is no cause. If there is a cause, by now you would have identified. I have had patients who I had with banana. I have had patients who had wheat. They will, or drumstick, they will come and tell you that when they have that. So for a person with urticaria, which is because of food, they usually identify. You tell them that anyone who comes and tells me that it is multiple food which is causing this, then most likely it is not food. Why that is happening? Because anytime, every time, before it comes, you would have had some food. And then you will implicate that. It is not that that is the food that has caused it. It was coming at that time. And before that time, when it is about to come, you have taken the food, and you should not be holding that responsibility. Why is this important? Why is this counseling about food important? Because many people, many patients, they stop all food items. Some will tell you, I have stopped mutton, chicken, mutton, this bread. Some is telling, I am only taking rice with water. We call it as, in Oriya, we call it pokhalabato or old rice. Some will come in Tamil Nadu, they will take only curd rice, and I'm not taking nothing. And then what happens? These persons become weak. They become angry. They become stressful. And then they cannot go out. For example, a wife has already announced, or a husband has announced that I am allergic to this, I am allergic to tomatoes. And then what happens? Once he goes out to a party, he breaks out this. They ask, did you eat tomatoes? Did you eat this? Then how many times I told you not to go? And then immediately fight. And then there is a fight. And you know what? House, the fight don't stop too early. It goes on and on and on. And this causes stress. And this is this stress that is going to make urticaria worse. So I tell them the effort of trying to find out the cause of the urticaria is the one that is going to cause the urticaria and not the cause by itself. Please take all the food. Please do not miss out on the drug. And you will find that over a period of time. And also it will give you a lot of peace of mind if you are able to take all the food, because nutrition is important. It is not the drug which is curing you. It is the time which is curing you. It is body's immunity which is curing you. It is the food which is giving you the strength to get cured. If you deprive the food, then you will get anxiety and you will become weak, you will become anxious, and all that will lead to aggravation. So counseling regarding food. So whenever I write, I make patient told that food is not important or no food restrictions unless in some cases where it's absolutely essential. For example, I'm giving cyclosporine. In that, I will write which drug, which food item should not be taken. I tell them that if the diabetologist tells you not to take this, don't take it. If the medicines person tells you for hypertension, don't take this, don't take this. If the nephrologist tells you don't take spinach or tomato, don't take it. But I am not telling you not to take anything. For your skin problem, I am not posing any restriction on you. Please take all the food items, which is very, very essential. Then regarding soap and shampoos, as the person is leaving, they will ask you, or they will even come back, or the attendant will come back, which soap to use, which shampoo to use. So you look at them, you tell them if your skin is normal, any soap and shampoo is okay. Soaps and shampoos are basically only for cleaning, and clean is what they do. It is very short contact. They don't get time enough to do any great deal of mischief. So you can use anything. But then if a person is an atopic person, or if the person is ichthyosis, or if the person is very old, diabetic, and got a dry skin, in those persons you tell them that avoid hot water while taking bath, take a lukewarm water bath, and apply moisturizer, and use a synthetic detergent soap, which has got a matching that pH that of matching that of the skin. In atopic also, we advise a person to use a synthetic detergent, which pH of which matches that of the skin. Because all other soaps are alkaline, and if the skin is damaged, then they can irritate. But if the skin is normal, we put a regular soap, be it Hammam, be it Margo, or Synthol, or whatever it is. But we also tell them not to use medicated soap. You tell them that skin has got a lot of bacteria. That bacteria is important to us. If you use medicated soap, the medicated soap is going to remove that bacteria, the good bacteria which is there, and is going to permit the colonization about that bacteria, which will not be restricted by the soap and that colonization. So use a regular soap, use soap sparingly. Do not let it be on your body for a very long time. Apply it, wash. Do not use anything to rub away this thing. Do not use any abrasives. Do not use loofah, because using loofah, the friction, you tell them these abrasives are not for human beings for taking bath. For some animals, fine, not for human beings, because that itself can cause pigmentation. And that pigmentation, which is caused by this, the macular amyloidosis, which is caused by this, will not easily go away. So avoid abrasives, soaps, and then just water itself is enough to clean, is what we tell them. Still, someone will tell you, tell me some soap. In that case, of course, you have to send the patient away. So you tell some name. What name you tell is not often very relevant. So thus, counseling is very important. The importance of counseling is when a patient comes to you, he is under stress, he is distressed, he does not know what to do. Whereas when the person is leaving you, he should go with hope. You should give him something to smile. You tell the parent of an atopic child that these children will be very active. They will get very angry, they will throw. The parents become very happy when you say that the child will get angry and throw something. When they say the mother-in-law will get angry, they are not going to accept it. When the child is going to get angry, it is acceptable to them. But then we can play on this and tell them that these people will learn very fast. They will walk fast. They will outtalk others much more. So tell them the positive side of a disease. And everything has got a positive side. Even the most hopeless person has got some good qualities. Likewise, most diseases have some positive side. See if we can find them and provide that to the patient, so that when the person goes off, they walk off with confidence, with their head held high. So nothing teaches us better about counseling than this Munna Bhai or its counterpart, uh, Robin Williams movie uh, on counseling, the importance of. So do counsel your patients well. These are some of my ideas. I'm sure there are many more, far better ones. And what I am telling can be improved upon. And please feel free to improve upon it. But then do try. This is as important as the drugs you give and your prescription. Thank you very much.